In this session, we'll have a quick review of general anatomy of the bone. So bone is a scleral tissue. It's a specialized connective tissue. Functions are like it gives shape to the body. It supports and protects viscera. Like in thoracic region, if you see, heart and lungs are protected by the thoracic cage. In the cranial cavity, the brain is protected by the skull bones. Movement. Bone provides attachment to the muscles. And the muscles can firmly contract because they have strong attachments to the bone. And bones store minerals, calcium, phosphate, and bones also helps in hemopoiesis. Constituents: the cells are osteoblast, osteocytes, and osteoclasts. So ground substance, water is 10%. Organic components, they are constituting about 30%, namely proteoglycans and glycoproteins. Inorganic components 60%. These are minerals, hydroxyapatite crystals, calcium, phosphate, carbonate, and citrate. The fibers are predominantly the type 1 collagen fibers. So classification, depending on location, depending on shape, depending on the structure, the two macroscopic structure and microscopic structure, and developmental. So depending on location, bones can be classified as axial skeleton and appendicular skeleton. You can see here the skull, the vertebrae, ribs, sternum, all these are axial skeleton, whereas the limb skeleton are the appendicular skeleton. So depending on shape, long bones, example femur, tibia, fibula, humerus. Then short bones, miniature long bones. Then flat bones, like you can see the scapula, parietal bone. Then irregular bones, pneumatic bones, especially the maxilla, sphenoid, ethmoid. Then sesamoid bone, so which develops in the tendon, and there will be no periosteum, no Haversian system, and ossifies after birth. Patella is the largest sesamoid bone. Pisiform is also a sesamoid bone. Accessory bones like sutural bones and posterior tubercle of talus. You can see here flat bone, irregular bone, vertebra, short bones, sesamoid bone, long bone. So the structural classification, if you see macroscopically, compact bone and spongy bone. You can see here this is a spongy bone and this outer part is the compact bone. So spongy bone, as you see here, there will be irregular lattice of thin columns trabecally. They reduce weight, protect red bone marrow. So trabeculae are oriented along lines of stress. Then compact bone, very dense and strong. So most of the bone mass in the body is compact bone. So spongy bone is located in the ends. Compact bone is located in the diaphysis. So on microscopic level, oven bone and lamellar bone. You can see here clearly the lamellae, layer by layer. And this will be the oven bone, irregular bone. So in oven bone, there will be haphazard organization of fibers. Osteoblasts produce osteoid rapidly. So in all fetal bones, oven bone is present, and later it will be replaced by lamellar bone. And even in fractures, initially there will be laying of oven bone. Over and above, there will be formation of the normal bone eventually. Lamellar bone, this is strong, whereas oven bone is weak. It's a secondary bone created by remodeling of the oven bone. Highly organized element of collagen in sheets. Fibers run in opposite directions in cross sections for tensile strength, and less osteocytes are present. You can see here in this so many osteocytes are present. Here less number of osteocytes are present. So developmentally, bones are classified as membranous bones, cartilaginous bones, and membranocartilaginous bones. So membranous bones are the bones which develop through membranous ossification. Cartilaginous bones are bones which develop through cartilaginous ossification. Membranocartilaginous are bones which develop through both membrane as well as cartilaginous ossification. can see the membranous ossification here. So in the mesenchyme, there will be direct development of the bone, osteoid tissue. You can see clearly there is deposition of osteoid tissue into the embryonic mesenchyme. And later on, you can see there is calcification of the osteoid tissue. And ultimately, you can see the spongy bone is being formed. And even the filling of the space to form compact bone at surfaces. You can see here, the compact bone is being formed. So here, the bone has directly developed in the mesenchyme. So this is cartilaginous ossification, where you can see the mesenchyme is initially replaced by the cartilage. Later on, the cartilage will undergo disintegration, and there will be formation of, here you can see in the shaft, primary ossification center, and here you can see secondary ossification centers, and there is an epiphyseal plate. So this particularly forms the epiphysis. This is the diaphysis and this is the metaphysis. And here you can see a completely developed long bone from cartilaginous ossification. So in membranous ossification, mesenchyme and directly the bone. Whereas in case of cartilaginous ossification, mesenchyme first cartilage is formed, then bone is formed. So what are the parts of a growing long bone? Diaphysis, metaphysis, epiphysis and epiphyseal plate. You can see here. So this shaft part is the diaphysis. On the ends are the epiphysis, and the part of the diaphysis which is towards the epiphysis is called as metaphysis, and the separation between the epiphysis and metaphysis is the epiphyseal plate of the cartilage. So once the epiphyseal plate of cartilage becomes bone, then the growth stops. So diaphysis is the shaft of the long bone, epiphysis is the either end of the long bone. Epiphyseal cartilage, it's a layer of cartilage within the metaphysis of an immature bone that separates the diaphysis from the epiphysis. So metaphysis is a mature bone, flayed area by the epiphysis. The periosteum is the one which covers the surface. The medullary cavity is the medullary cavity, where you can see there will be bone marrow. Epiphysis. There are 4 types of epiphysis. Pressure epiphysis, example is head of femur, where it bears the weight. Traction epiphysis, greater and lesser trochanter of femur, where there is maximum pull by attached muscles. Atavistic epiphysis. So coracoid process of scapula is an example for atavistic epiphysis. Actually, it is a separate bone but fuses during development with some other bone. So coracoid process of scapula and posterior tubercle of talus. Then aberrant epiphysis. So it was not supposed to be present. Epiphysis at the head of the first metacarpal. Usually the epiphysis should be at the base of the first metacarpal. So posterior tubercle of talus, coracoid process, atavistic epiphysis. These are the traction epiphysis. This is the pressure epiphysis. This is the aberrant epiphysis. So main blood supply to the long bone is by the nutrient artery, followed by periosteal arteries, metaphyseal arteries and epiphyseal arteries. You can see here, this is the nutrient artery. You can see the metaphyseal arteries. You can see the epiphyseal vessels. You can also see here the periosteal vessels. So developmental classification, membranous ossification and cartilaginous ossification. So in cartilaginous ossification, we will see the primary center, secondary center. So law of ossification is that the center which appears early fuses later, and the exception for this is fibula. Fibula does not obey law of ossification. So bone remodeling, you can see the bone lining cells. So resting state. Here you can see the resorption, osteoclast is removing the bone. Then reversal. Then you can see here osteoblast forming the bone. Then mineralization. Then again resting stage. So factors for bone growth: vitamin D, C and A, certain hormones, like calcitonin, parathormone, then genes and mechanical factors. So all these play an important role in maintaining the growth of the long bone for sufficient duration. Any deficiency in vitamins or hormones will result in bone deformity. Suppose if we see vitamin D deficiency, it causes rickets. Like if you see hormonal problem, like if you see there is deficiency of growth hormone, then there will be dwarfism. If there is excess of growth hormone, then there will be gigantism. So what are the commonest um, clinical things which we deal with the bones will be? Most commonest will be fracture. So the next one will be the osteomyelitis infection. The next one will be the Paget's disease. You can see here different types of bone fractures. Like you can see a transverse fracture. You can see an open fracture where the fractured bone fragment is exposed to outside. You can see an oblique fracture. You can see an oblique displaced fracture. You can see comminuted fracture. You can see a segmental fracture. You can see an avulsed fracture. You can see a spiral fracture, and you can see a green stick fracture. There is no complete fracture, only some part is fractured. So osteomyelitis, clearly you can see the osteomyelitis of the upper end of the tibia, where the metaphyseal vessels, in the metaphyseal vessels, the flow of blood will be slow. So this is a specific site where organisms will accumulate and start invading, causing infection. So infection of the bone, which ultimately leads to inflammation. So microorganisms reach bones via the bloodstream. The factors which are actually in relation to osteomyelitis are the virulence of organisms. Highly virulent organisms will cause severe form of disease. Host factors, age, immunity. Immunocompromised people are more prone for the disease. Local factors like site of involvement, if there is any damaged muscle, and if there is any problem with the vascularity. So Paget's disease, you can see the deformity. Thank you.